rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hi everyone, today I saw a patient with advanced pancreatic cancer whose overall condition had deteriorated significantly. His family asked an important but difficult question. Doctor, how much time might he have left? Rather than relying on clinical impression alone, let's take a closer look. Our patient is a 72-year-old man with advanced pancreatic cancer receiving palliative care. He is now almost completely bedbound and requires full assistance with his daily care. His oral intake has declined to only a few mouthfuls at a time. However, he currently has no peripheral edema, no dyspnea at rest, and no evidence of delirium. Let's assess this case using the Palliative Prognostic Index, or PPI, calculator in the OncoToolkit. The Palliative Prognostic Index is a validated bedside tool used to estimate short-term survival in patients with advanced cancer receiving palliative care. It evaluates 5 simple clinical factors: the Palliative Performance Scale, oral intake, edema, dyspnea at rest, and delirium. First, we'll select the patient's Palliative Performance Scale, or PPS. This patient is almost completely bedbound, requires total assistance, and has very limited oral intake. His PPS is 20%, so we'll select PPS 20%. Next is oral intake. The patient is able to eat only a few mouthfuls of food. We'll select mouthfuls or less. Now we'll assess edema. There is no clinically significant edema, so we'll select absent. Next is dyspnea at rest. The patient is comfortable while resting and does not experience breathlessness. We'll select absent. Finally, we'll assess delirium. The patient remains alert and oriented without evidence of delirium. We'll select absent. Once all 5 clinical variables have been entered, click Calculate Score. Here are the results. The patient's Palliative Prognostic Index is 6.5. This score exceeds both published prognostic thresholds. A PPI greater than 4 is associated with an expected survival of less than 6 weeks. A PPI greater than 6 is associated with an expected survival of less than 3 weeks. Because this patient's score is 6.5, both prognostic thresholds are met. It's important to remember that the PPI estimates prognosis at the population level and should never be interpreted as an exact prediction for an individual patient. To understand how the result was calculated, expand how this result was calculated. The Clinical Summary tab displays the patient's total PPI score together with the prognostic thresholds that have been met. Next, open the Detailed Model Math tab. The PPI is calculated by assigning points to each of the 5 clinical variables and summing the total. A PPS of 20% contributes 4 points. Oral intake, limited to mouthfuls or less, contributes 2.5 points. Edema is absent, contributing 0 points. Dyspnea at rest is absent, contributing 0 points. Delirium is absent, contributing 0 points. The total score is therefore 6.5. The PPI ranges from 0 to 15 points, with higher scores indicating a poorer short-term prognosis. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save Results. Previously saved assessments can be viewed anytime from the Saved Results panel on the right-hand side. Below that, the Clinical Workflow section explains when the calculator should be used, how to interpret the results, and how to incorporate the assessment into routine palliative care. The PPI should always be used alongside clinical judgment, ongoing reassessment, and discussions about the patient's goals of care. Next, let's scroll down to the reference data. Here you'll find the original evidence supporting the PPI, together with the published prognostic thresholds and their reported diagnostic performance. The Palliative Prognostic Index provides a simple and structured method for estimating short-term survival using 5 bedside clinical variables. While it offers valuable prognostic information, the results should always be interpreted within the context of the patient's overall clinical condition and should support, not replace, professional medical judgment. For more oncology calculators and clinical decision support tools, explore the OncoToolkit website.